We're here today with Alexa Haralambous, who is 1 year out from her carpal tunnel surgery with Dr. Sarkos. At just 24 years old, she went through the full journey, including physical therapy with Emily Morales. And she's here today to share what that experience was like. Hi, Alexa.
Hi.
We're so happy you're here to talk about this experience. I want to know, to start off, can you tell us a little bit about what your symptoms were that you were experiencing?
So I was experiencing some numbness in my hands at night. It was mainly waking me up and it was very tingling sensation, more tingling during the day, but mainly numbness at night.
Yeah.
That was waking me up.
Was it both hands?
I didn't really recognize at first which hand it was. I just thought, it was the way I was sleeping.
Yeah.
But it was actually just one hand when I realized what was going on.
And how long do you think the symptoms lasted before you decided to seek medical attention?
Not long, considering I'm a hypochondriac. So I did some digging of my own, and
Yeah.
everybody found it hard to believe that I thought it was carpal tunnel, and it just so happened to be carpal tunnel.
Yeah.
So probably about 3 weeks.
Okay. And how were these symptoms, if at all, how were they affecting your daily life, like your hobbies or driving or?
They were mainly affecting my sleep, and sleep is very important to me. So I was not messing around with that
Yeah.
before I got treatment.
So what made you finally decide, you know what, it's time. I just can't deal with this anymore.
I think when I used to go to sleep, I would have my whole routine and I would get so excited about going to bed. But then at some point, I stopped being excited about going to bed because I knew I was just waiting to wake up
Yeah.
and from the numbness.
When you finally made the decision to have the surgery, did you have any concerns, any hesitations?
No, Dr. Sarkos was really reaffirming in that we could either do three things. We could leave it alone. We could do a cortisone shot, which isn't guaranteed to work
Yeah.
and really hurts. And then my last option was just to fix it. And I said, let's just fix it
Yeah.
because that's what's guaranteed to work. My main concern that I addressed with him was that would it come back? And he had said none of his patients came back with the same symptoms and having the same problems because he does it, he fully opens the hand
Yeah.
to be able to see a little bit better and make sure he gets everything as much as he can.
What was your procedure like? What was your experience like? Did you go to the hospital? Was it outpatient? Did you go home the same day? What was that like?
It was outpatient. I went home the same day, so I got a call from the hospital in the morning, and they told me what time to come in. I was a little antsy because I was waiting in the hospital for a little bit before Dr. Sarkos was able to bring me back, but
Yeah.
once he came in and saw me, I felt a little bit calmer, and he reassured me that we're just going to do this and it'll be okay, and they did give me some medicine for just to calm my nerves. But yeah, it was in a Vineland hospital.
Okay. And when you woke up from the procedure, that was like the immediate start of the recovery process. Take us through that a little bit. I mean, what were some of the sensations you were feeling, if any?
Well, I woke up crying just because of the anesthesia. I was in a room kind of by myself with curtains, and I was just scared. And I looked down to see my hand
Yeah.
completely wrapped and covered. I think the beginning was a little hard because I felt very claustrophobic in the cast I was kind of in.
Yeah.
But after I got that removed, I felt a lot better, and I was able to sleep perfect that night. That
Yeah.
was the first full night's rest that I gotten in months.
How
So
about pain? Was there any pain throughout the healing process that was just unbearable?
So they gave me a nerve block the first couple days of surgery that I had, so I was very numb for about 2 days, and which was normal.
Yeah.
And I think that really helped with any pain that I would have had if had I not gotten the nerve block. But other than that, I really had no pain. It was a really painless recovery, even
Yeah.
after the nerve block wore off. I tried my best not to touch it and follow the instructions of my surgeon.
Yeah.
And I think the hardest part and the most painful part was physical therapy with
Yeah.
occupational therapy, I guess, and just getting my hand moving. And my occupational therapist, Emily Morales, she had let me know that your hand thinks it's missing something, but it's not. So just move it as normal. And if you can't hurt it. So
Yeah.
I think that was a really important thing to remind myself.
So are you kind of saying that your fear of moving the hand was just maybe more fear than your hand's ability to move?
Yeah, I
Yeah.
was very scared that I would hurt it, after my stitches were removed, and, I was scared to hurt myself
Yeah.
and make anything worse, so I was very conscious of how I slept at night, how I was moving, and, just being extra safe with it, but I think a lot of it was mental at first,
Yeah.
and then it just became you have to push through that mental block to actually feel stuff.
So today, being March 18th, you are literally 1 year out from your surgery. Congratulations on that. And how does your hand feel today compared to how it felt prior to surgery?
It feels perfectly fine.
Yeah.
Believe it or not, I'm still a little just conscious of everything I do,
Yeah.
being that I had carpal tunnel. They always say that you don't know what actually gives it
Hmm.
to you, makes you have carpal tunnel.
Yeah.
Could be anything from genetic to your keyboard to the way you're sleeping at night. And
Yeah.
so I'm just extra conscious of my movements. And yeah.
Is there anything that you're doing now that, in terms of hobbies, like do you lift weights? Do you work out, like Pilates, yoga, that you notice your hand feels steady and strong again?
Uh, I think I didn't have as much weakness as anybody else probably would because I did seek treatment very quickly.
Yeah.
I think I do notice that the tingling has subsided. I
Yeah.
did have a little bit of tingling in the beginning, just my nerves kind of healing and coming back, and it can take up to 4 years to fully heal.
Yeah.
My physical therapist said. So I think always giving my body grace in that aspect of just letting it heal and reminding myself that I'm going to feel things in that hand because I did have surgery on it. So I think other than being able to sleep at night, I don't really notice anything different.
Oh, good. So, what would you say to someone who has similar symptoms and might be hesitant, thinking that, it's really going to impact their life? They have to be, what was it, like 6 weeks recovery for you before you could use your hand?
Yeah.
Yeah.
And I think it depends on your surgeon, but Dr. Sarkos always made sure to tell me, this is a quick surgery and at most maybe a 20-minute surgery, 10-minute surgery. And uh, it's so minor. He does a lot of these every single day. So
Yeah.
I think him reassuring me that this is kind of a common practice for him and in other people, it really helped me with my recovery process. And, he had mentioned to me, the longer you wait, the more damage that can be caused. I
Right.
think the worst part for me was the EMG. That was really painful.
Mm.
That honestly, the EMG was more painful than the surgery. So,
Yeah.
but I had to, get there before the surgery. So I think the quicker you do it, the quicker relief you feel, and
Yeah.
that's worth it to me.
Okay, good. Well, thank you for sharing your story with us today. We're so glad you're doing well.
Thank you.